I'd like to welcome everyone. My name is Rebecca Munnerlin. I'm with Prisma Health Media Relations, and um, we are very glad to be able to speak with you today. And we have Dr. Pamela Bailey from our Infectious Diseases Division with us today. She's an infectious diseases specialist, and she's here today to answer some questions for us about the measles. We did a press conference back in May when we started talking about measles a lot, and we covered it pretty comprehensively, especially from the pediatric side. But I think it's probably not a bad time to have a little bit of a refresher. So we thank Dr. Bailey for just kind of reminding us of what measles is, what symptoms that causes and why it's such a big concern. And I'll be happy to, after we cover a couple questions, to take questions from you all, or if you'd like to post them in the chat, that makes it pretty easy. So I'm happy to pose those. So again, welcome, Dr. Bailey. Thank you so much. I understand it wasn't long ago that you were actually talking about measles at a conference, so this is fresh on a lot of people's minds, obviously. And I was wondering if you could just start for us to give us an overview of exactly what the measles virus is.
So, measles virus is traditionally considered a childhood illness, but it can affect people of any age, particularly if you are non-immune, either through vaccination providing immunity or a prior history of disease. It is spread through the air, so in coughing and other talking and some of those secretions. And it does stay in the air after somebody who has measles has come through an area. It stays alive in the air as infection up to about 2 to 3 hours after somebody has passed through. So it is very contagious because of some of these factors. And anybody who does not have immunity can be infected. It takes about 10 days to potentially from exposure to symptoms. It obviously depends on your body and how you respond. It may be sooner or a little bit later. The first couple of symptoms are usually what we call cough, coryza, and conjunctivitis, the three C's that doctors know to look for. Cough, obviously, a dry cough. Conjunctivitis looks like pink eye, a lot of inflammation in the eye. And then coryza is just kind of that drippiness around the eye or the nose. The rash often comes afterwards, but that is what most people are looking for and what traditionally people think when they think measles is a very classic spotted red inflamed rash. That usually comes about day 2 to 3 after the first kind of non-specific symptoms start, and then it just takes a little bit of time for that all to go away. Usually the entire illness does not last for more than about a week. It can be longer in people who are significantly immunocompromised.
So you mentioned the transmissibility of this. I think we remember hearing about cases that were classified as an outbreak in Texas not too long ago. Um, Again, just to give us an idea of how transmissible this is compared to something like COVID or the common cold, what should we know about that?
Um, Many epidemiologists and infectious diseases folks and those who work in public health consider measles the most infectious disease known to mankind. Partially because it's spread through very small particles that stay in the air. We often say that measles can go on to infect up to approximately 18 people. Like one person can go on to infect a significant number of people. Those numbers are much, much smaller with COVID or flu or many of the other illnesses that we think of being transmitted either through touch or through the air, and if obviously if somebody coughs or sneezes on you. So that's one of the things that is so concerning about measles is the sheer number of people that can be impacted by one case.
Got it. So with with measles, I know that there's been a vaccination available for a very long time. Can you update us on what the stance on measles vaccination is, including for those people who are a little older, like me, who maybe were vaccinated in childhood, but wonder if maybe we should get it again? and what the recommendations from your expertise are.
Yes, those are very common questions that have been coming up as anybody's been watching the West Texas outbreak. So, measles is a two-dose vaccine series. It's been two doses since 1989. So, many people who are adults have received either one or two doses, and that protection is meant to be lifelong. It is a childhood vaccine recommendation. So you get the first dose around 12 months, and then the second dose around 4 years before going into school. It is usually in combination as the MMR, so the measles, mumps, and rubella vaccine. And so that is a recommended vaccine before entering school. And it is prevention is the most important thing with measles. We'd rather people didn't develop measles, so that's why we like universal vaccination and rates higher than 95% in terms of vaccination to provide herd immunity or protect the entire community from a measles outbreak. Now, there's also people that we say were born before 1957 is the cutoff of when measles was widespread in America. So anybody born before 1957 is presumed to have immunity from disease, that they got it, they had it before the vaccine was available. Um, there are tests that can be done both in people born before 1957 or in people who received the vaccine that can check the level of your response and your protection. There are people who take a lot of confidence in having those numbers to show that you are immune. Our healthcare workers are actually all have to prove that they are immune before working in healthcare because of the contagiousness of this disease. So it's a commonly available test if people are concerned. But also, if you have your vaccination records that show that you were vaccinated with two vaccine doses, you can be confident that you are well protected and shouldn't need to get the titers or be overly concerned.
Titers was a new word for me when we were talking about measles back in May. So that's basically that shows if you have an immune response.
So the titers are a number that once you do a blood sample, you can do a titer, and we do this for lots of different diseases, but you can check what that number is. And there are certain thresholds that have been determined to say you are immune, you are not immune. So I find it helpful in my born before 1957. Some of my immunosuppressed folks who are worried that the medicines that they're on may make them more susceptible to measles. And I've also had a few people who've received chemotherapy, which, depending on the kind of chemotherapy, may wipe out your immune response. And so those people may be candidates for revaccination, depending on titers. Um, so there's a lot of individual circumstances that may need to be taken into consideration, but most people have received the two-shot vaccine series and presumed lifelong immunity.
So tell us a little bit about what the most concerning dangers of measles are. If you contract the measles and you've been confirmed to have the measles and you're showing those symptoms, um, for, and I don't know if it's different for adults and children, but what are the most concerning outcomes regarding measles?
So most of the data that we have is from children simply because they're generally either unvaccinated or too young to be vaccinated. So a lot of the data does exist in children. But approximately one third, so one in three cases, is complicated by a serious condition requiring hospitalization. It could be inflammation of the lungs, it can be inflammation around the brain. Those are usually some of the most typical. The problems there is obviously inflammation in the brain can lead to serious consequences like deafness or blindness, depending on what area of the brain may be most inflamed. The lung disease is often temporary, but everybody's a little bit different. So we certainly worry about the 1/3 of cases that require hospitalization due to complications like that. There is also serious, compelling evidence about a measles infection wipes out your immune memory to everything else except measles. So, for years after somebody has had a measles exposure, they are susceptible to all kinds of things, flus, common colds, diarrheal diseases, and all kinds of things. It's called immune amnesia, where your body just forgets everything else. And that's a really serious consequence because obviously those recurrent infections can be very serious after the measles.
So some people who become very ill actually become ill because of a secondary infection that measles has laid them vulnerable to.
And the other thing is, the encephalitis, the brain inflammation, or the pneumonitis, the lung inflammation, can lead in that moment during the measles episode, can lead to very serious, what we call super infections, where you have the viral infection that then, because of all the inflammation, you can get more bacterial infections or even more viral infections on top of that. So it's both in the immediate time around the infection as well as years after the fact.
If you do believe that you may have the measles, what should you do and what should you not do?
My biggest recommendation is to first off try not to panic. It can be very scary, of course, and there's often high fevers and the rashes, and they're like, what is going on? One of the most important things is to call your doctor before going to the hospital or the pediatrician's office or an urgent care or clinic or things like that. Because of the transmissibility, we generally do prefer not that if you need it, walk into the ER, absolutely, if you need medical care. But we would prefer advance notice because this is so contagious, we try to do a lot of the workup at home. Like we can collect the swabs and coordinate with the Department of Public Health to limit the number of exposures to other people. But even if you do need medical care, sometimes we can call, if you call ahead, people can bring you in like a back door directly to a clinic room. Staff know to mask and protect themselves. You're not in a waiting room with other people and things like that. Because again, a lot of people are immune, but this is very, very contagious.
So I guess our hope is that if we develop cases in our region, wherever we are, that, there would be some public health notice that cases have been reported, in which case, it sounds like maybe some of the protocols that we're familiar with from COVID, people might think about like masking in public group settings and things like that. Um, I don't know that we've had any type of alert to that degree in our state or region so far. Well, at this stage at all. So, but would those recommendations be similar since, to be honest, early measles symptoms sound so similar to so many other viral infections, it's hard to know.
Yeah, anything that can interrupt what we call the chain of transmission. So, hand hygiene, masking. In healthcare, we would require the N95, the very fine mask filtering out the very fine particles. But even what we call the droplet mask, the surgical mask that many people became familiar with during COVID, it at least drops the amount of particles that somebody might be um, expressing, putting out into the environment. So anything that reduces the number of particles that somebody can come in contact with is a good thing. And there's been a number of cases where people think measles and it's not. It is flu or COVID or something else because of the non-specific symptoms. So there have been many, where we as medical providers are on higher alert, paying attention to the outbreak in West Texas, the spread across the United States, the international travelers who are returning after being exposed in another country that may or may not have as good protection or awareness that where they're going is a measles outbreak. But anything that protects the community, that's why we also say stay at home, wear a mask, wash your hands, call people to try to reduce the number of people that are just being exposed.
Such good information. And just to sort of wrap it up, if when someone is diagnosed with measles, how is it actually treated? Is it one of those viruses that um, there's not a specific treatment for, or it just depends on how it manifests in the individual patient?
There is no treatment for measles. There are studies in the developing world where malnutrition is common, that vitamin A supplementation may be effective in helping with some of the symptoms, but that data is not supported in the United States. There's some great resources from when we previously had outbreaks before vaccination was so widespread that showed in the United States it did not mitigate anything. Now, if we have cancer patients, there are some experimental things that we can do to help the immune system along, but that would be very much in the hospitalized cases in folks who are already immunocompromised to try what we can. But no, this is definitely one where the vaccine and the prevention of disease is so critical because we just have to honestly ride it out.
Got it. Well, thank you so much. If there are any other questions from our media partners who are with us, if y'all would like to post any of those in the chat, please do. Dr. Bailey, is there anything else you'd like to add to what we've learned today? You
I
covered
mean,
it
I
really
can
well.
talk more about the vaccine.
Sure.
It is the vaccine is very effective. It is a bit of the controversial ones right now, but I would like to reassure parents who are certainly reading the news and seeing all of the controversy that the medical institution, the scientific community is very confident in the safety of the vaccine as well as the effectiveness of this vaccine. It is one I am grateful to have received as a child, and I definitely promote it for all of my patients.
Great to know. Well, that is reassuring. Okay, I think we've covered it well. Well, I see one question just posted, talking about how anti-vaccine sentiments may have contributed to outbreaks and whether that could have an adverse effect in South Carolina particularly.
One of the concerning things that those of us in public health have been watching the last couple of years is watching the number of children entering school who are not vaccinated for measles in South Carolina. This is readily available data through Department of Public Health and also on the CDC website. We have dropped below the 95% threshold in the state of South Carolina. We are ripe for outbreaks. There are also pockets of communities who, for cultural reasons, may have chosen to not vaccinate. And those can be very big outbreaks, similar to what happened in West Texas earlier this year, prior outbreaks in New York in Rockland County. So continuing to emphasize the safety, the effectiveness of the vaccine, the fact that there is no treatment, and that if you have concerns, please talk to your healthcare providers. We are well equipped in answering any question, and there's no question that's too silly about vaccines. We understand, particularly in these cases, that parents are just trying to do what's best for their children, but we also want to make sure that you are getting scientific evidence and not necessarily something from social media.
Right. And help me understand that 95% number you stated, the 95% threshold. Does that mean that 95% of children of school age are not, or I'm not sure what age, are not vaccinated?
So 95% is the herd immunity threshold, where we have enough people vaccinated in the community that a disease, such as measles in this case, cannot take root in the community. There's enough vaccinated people to stop spread because, for example, if I inhale measles, I'm not going to develop the disease. My immune system is going to knock it out, and I will not then be a vector to pass on measles to anyone else. So that's what we look at with herd immunity thresholds. So for measles, it is 95%. It's one of the highest ones for the record. But again, because measles is so transmissible. So the data on entry into school, so generally around 5 years old, we have dropped below that 95% threshold. The last time I looked, it was approximately 93%. So we're not that low, but again, a very transmissible virus. So it's concerning.
So getting your vaccine can make a difference, not only for yourself, but for other folks in protecting with that herd immunity level of protection for our whole community. That's so important. Well, thank you again, Dr. Bailey. I think we'll end it there. We appreciate everybody jumping on for this quick refresher, and thanks to everybody for their participation in sharing this news so that we can keep the community up to date on what's going on. Thank you so much. Bye bye.